Morning. What's your overall take on what's happening with COVID as of today?
Thanks, Kay. Good morning. We're very alarmed. We have just surpassed, very sadly, the 1.5 million death mark last week. If we continue on the current course, we are projecting a further over 500,000, 500,000 deaths by spring next year. That's really worrisome. Of course, public health cost, the cost to our economies, the stress on our hospitals and communities, and our ICUs, of course, our intensive care units. So we're very concerned. We, in the European region, the 53 member states that WHO regional office here in Copenhagen serve, only 54% of the population of this region are vaccinated. So there's so much work to be done still. We're not there yet. And it looks like we're going to have a worrisome season ahead.
What's driving the resurgence of COVID in mainland Europe? Is it the lack of vaccines, or is it, as the guy who is the chief executive of AstraZeneca has said, the vaccines in the UK on the elderly the AZ vaccine worked much more effectively?
Well, it's partly due to there being too many vulnerable populations to infection of vaccination. Also, we're seeing waning immunity of these vaccines, especially around after the 30-week mark of the full course. Also, we've got, as I say, 47% of the entire population unvaccinated. And the unvaccinated, let me be absolutely clear, the majority of people in intensive care units and ICUs today are the unvaccinated. But there are other compounding factors, Kate. Winter. This is a seasonality observation we're making at the moment. People moving indoors, need for masks, a need for more ventilation. Masks, as you possibly saw from the British Medical Journal, the BMJ this last week, showed a study where 53% of transmission was prevented by mask use. We only have 48% of the population in the European region using masks. The moment we saw that go up, if we see this go up, we will see a reduction in cases and a reduction in deaths. If we saw 95% universal mask use, we could project that we would save about 160,000 lives. So this is a number of factors, plus the more transmissible Delta variant, which is accounting for about 99% of the cases in Europe today. That's why this is happening.
So wearing a mask would save 160,000 lives in Europe or worldwide?
Europe. If we saw 95% mask use, we'd see over 160,000 lives saved from the projection that you stated earlier.
Okay, and just if I could take you back to the AstraZeneca line that we are in a lot of the newspapers this morning, Pascal Soriot suggesting that his vaccination, the AstraZeneca jab, being used on older people more here in the UK than in Europe, that is the reason that Europe is doing not as well as the UK is.
Well, I wouldn't start comparing different vaccines. I mean, all vaccines have been used in elderly populations. There are varying vaccination coverage rates across Europe. And that's why we're seeing this Delta variant, this highly transmissible Delta variant, find out these pockets of vulnerability and susceptible populations. I don't think it's useful that we go into which vaccine has done better where. What we need is every member of society vaccinated. And of course, those that are particularly vulnerable, the elderly, the healthcare worker, of course, healthcare workers, our front line, those that are immunocompromised, that they take a booster when they're offered one. This is also very important and will make a big difference.
Should we be travelling at the moment?
Travelling, but travelling safely. I'd like to think we're going to have a Merry Christmas, but a safe Christmas. So I think we all hope, as do my own children, hope that Christmas is on. We believe it is, that people will be able to travel. We hope that they will be able to travel. But I think a bigger question is how they behave when they travel. So again, mask use, physical distancing, hand washing, and adherence to those public health social measures will be so much more important over this coming season.
But we don't need to worry about travelling around Europe at the moment, given the numbers that we're seeing in Belgium and Germany and Austria and the like. And then obviously the travelling from the United Kingdom to Europe, the WHO still feels that that's acceptable?
Yeah, we think that the travel route should be kept open at this point, but that care should be taken. And of course, vaccine passports used where they're being used, where they're, I'm sat in Copenhagen, where I cannot enter buildings without my green pass. These passes, if you like, are actually providing us, enabling us to avoid lockdowns and remain able to move. So that's a very good thing that they're used and applied in many member states today.
You must be frustrated to read that the British government has destroyed something like 600,000 vaccine doses because they're out of date when they could have been shipped to countries that need them.
Indeed. I mean, what I think we keep explaining to our member states and try and communicate as clearly as possible is that we need to keep an eye on supplies. We need to make sure that there is equitable distribution of these vaccines, and that if countries plan to, for example, start booster campaigns, etc., that they are confident that they will be able to use the vaccines that they order, that they are provided, because of course there is only a finite supply.
And what happened? And your thoughts on throwing them away?
Well, it's never good to see a vaccine thrown away, of course, but this can't be avoided. If you don't have the demand for the vaccines, or your system doesn't allow you to present those vaccines, administer those vaccines, then of course they have to be thrown away if they're out of date, if they expire.
But presumably we could be in a position via COVAX where we can transport those vaccines. You know, if they've got the sell-by date on them, the use-by date on them, we can put them on an aeroplane and send them to Africa.
That's what we're promoting. I mean, where we can, let's see that vaccine solidarity across Europe and across the world. Indeed, I couldn't agree more.
And as far as the sell-by dates on these vaccines are concerned, we were speaking to our resident GP about that a little while ago, and he was saying it's different. Obviously, we can't use them after the use-by date. But how do we know that they're no longer usable by that date? Because they're a new vaccine. We don't know how long they're going to last. Do you have a view on that?
I don't really. I mean, good manufacturing and pre-qualification that WHO conducts on all of our vaccines basically suggest an expiry date as to the manufacturers, of course, and we adhere to that. These are new vaccines. So still a lot of, as you've just alluded to, a lot of studies still ongoing. A lot of science still to be found around the vaccines and their longevity. Of course, we're all hoping that we can see vaccines lasting longer, and of course the waning immunity that we're seeing at the moment. We need to tackle that because we need, of course, not to see that in the future. We need those vaccines to be powerful enough to protect us all in the long term.
Okay. Quick thought before I let you go. Where are you on compulsory vaccines?
Mandates, compulsory vaccine. It's a healthy debate right now. I mean, mandatory vaccination can, but doesn't always increase uptake. There are lessons of history here where mandates have come at an expense of trust and social inclusion. So it's very delicate, but we believe it's time to have that conversation. Both from an individual and also a population-based perspective. It's a healthy debate to have.
Okay. It's good to talk to you. Thank you very much indeed for joining us on the programme this morning. Thank you, Mr. Butler from the World Health Organization. Thanks a lot.